Hey everybody, this is Dr. Perry from Stop Chasing Pain coming at you with an In the Trenches series, and I'm going to talk a little bit about the important role that the flexor hallucis longus plays in movement dysfunction, and particularly when people who have knee pain and back pain. I see this a lot, and I evaluate it in every single one of my clients, and you should do the same. So I'm going to kind of meld some worlds here from what I would do in physical therapy world for the docs or therapists out there, and then also what I would do for people that are more fitness enthusiasts, because there's some self-help things you can do on your own. But basically, I'm going to show you my foot here, so you get some really good close-ups view of my foot. But basically, the flexor hallucis here is a tendon that runs on the bottom of that big toe, comes up underneath here, wraps around, and it actually inserts up into your calf here near the fibular head. And becomes really tight, and if it gets tight, it's going to restrict that extension of the big toe, and you want about 65 degrees of good toe extension to make sure you got a nice gait and toe off. If that gets restricted, you're going to alter the gait mechanics, and you'll feel it in your hip and your knee. So what I usually do is just check that motion, and each time I evaluate somebody, if it needs to be loosened up, I'll actually do some laser therapy on it. So I'll actually take the laser therapy here, and then what I'll do is I'll take the massage ball and I'll just laser right up underneath, and I'll do about 1500 to 2000 joules right on the bottom of the foot, and then I'll go into the calf as well, and then I'll go all through the calf with about 3000 joules, so I can hit where that muscle and tendon start. And then what I'll also do is take lacrosse ball, and I'll put that on the ground, and then I'll roll my foot on the bottom of that back and forth to hit that plantar fascia, and then I'll do some active isolated stretching work on that big toe. I'll extend back and I'll pull back into it, and I'll count 1001 and then go back, and I'll do 10 repetitions of that. And remember, you want to do about 10 repetitions, hold that stretch for about 2 seconds, to 2 pounds of assistance at the end, and make sure you breathe and exhale on every single one and stretch into movement. I'll do some foam rolling on the calf, then I'll get up and do some dynamic movements with that. So see how that does, and working those areas on both of your feet, and I guarantee you'll notice a big difference in how you move in your back, you feel in your knee, and you can really get a lot of chronic back pain to relieve with that. So make sure you check and evaluate both sides. This is Dr. Perry from Stop Chasing Pain in the Trenches live action. We'll see you soon on the other side, and check us out on stopchasingpain.com.